Uh, Hello, everybody. Good afternoon. Thanks for being here. We'll go through all of our data, update a couple items, some new announcements, take some questions. We've had a tough go at it over the last week, a little bit longer than last week. The reality of the pandemic is that when we dealt with this in the spring, the conditions of which we were dealing with the virus that we knew very little about were in our favor. The back end of a season, this is a COVID virus. Other COVID viruses are colds. We know when colds do well, they do well in these months. And this virus is testing us. We lost 6 more residents in the community yesterday, 2 hospital deaths. We lost a female in her 90s, a male in his 80s, and then we lost 4 of our neighbors in nursing homes. We don't get information on those neighbors of ours. We get that updated through the state website. In addition to that, we lost baby Ajay at the zoo. I'm wearing my elephant tie today in honor of the baby. Baby Ajay was an amazing elephant who we all got to appreciate, and we're lucky the time we had with the baby. So that's very sad for our parks team and our zoo team. These animals are like children to them. So certainly let's keep in our thoughts and prayers all of our residents we've lost over the last few weeks. In the pandemic, we've now lost 282 members of our community. Looking at 7-day averages, positivity rate 5.8%. Again, we're in New York, we're performing better than the country. We're performing essentially better than most counties as far as a positivity rate at this moment in time. That still doesn't change any of the facts on the ground that we are in a very, very big fight with this virus. 248 individuals in the hospital, essentially flat from yesterday. That's probably the good news of the day when you look at this data, is that we have more people coming into the hospital because they're sick, but we had a lot of discharges yesterday. So we're going every 24 hours on this. And so that's probably the positive news. We have 45 people in the ICU, and certainly please keep them in your thoughts and prayers. We have 20 individuals that are waiting to be released to their residents. These are folks in a nursing home. Again, I'll explain this. This is important as we focus more on hospitalizations in this process. There's an executive order that says if you're COVID positive, you go into the hospital and you live in a nursing home, you cannot go back into that nursing home until you've tested negative for COVID. That's the executive order. The challenge with that is it takes weeks, sometimes over a month, before once you've recovered from COVID, before you'll test negative. So even if you think about your own self, you get COVID-19, you isolate for 10 days. If you were to take a test a week or 2 later, you're probably still going to test positive for COVID. So what's the challenge? The challenge is when we have hospital capacity constraints, potentially, having those folks in the hospital just there when they don't need to be there is a problem. So we've been working with our partners. We'll be submitting a plan to the state today that hopefully will get approved, and we'll be able to address this issue. This issue today is 20 beds, but we've seen a constant flow from nursing home cases to hospitalizations to ICUs. So there's a pipeline of cases, and this is going to continue. So this will be a bigger problem if we don't head it off, but we got a plan, and hopefully we'll get the state's approval on that in short order. When you look at, a lot of people ask the question about how many beds do we have, where does that stand? Before the governor's order of 25% capacity increasing, our 3 hospitals, not including the VA, 1,694 beds. Each day we're tracking that. Remember, a hospital to be able to exist, needs to take care of people. You can't have 0 people in the hospital, or else the hospital doesn't work. They can't pay their employees. So there's always a level of capacity that is going to be there in the hospital. 1,225 people were in beds this morning. So that leaves you capacity, basically been about this 30% range capacity for the last 3 days. That hasn't really changed. What's going to happen is that this governor has an order. They're going to beef up their capacity, 25% additional rooms. So that will mean that there will be 25% more rooms than 1694. And so when you look at the capacity, our workers in the hospitals are working very hard, and they're working very long hours. There still is room for more sick people, but that doesn't change. It's very hard in this process right now. So that's something that, again, that's the really what the state's looking at as far as future regulations on commercial activity. That's what we're looking for at monitoring, making sure not one hospital is becoming overflowed, working with all of our partners. So that's the game where we are right now. Looking at new cases, we've had 13,403 positive cases since March 16th. We have 293 new cases today. The 293 number is less than the last few days. We've had a surge from where the Halloween surge brought us here, Thanksgiving surge has brought us here. We've kind of flattened off. We're going to have a high day tomorrow. That will be the highest day. We don't know what the final number will be, but it will be our highest day. We don't know if that's a one-day occurrence yet. We'll see. And so we've 300 from the 225 range. Again, a lot of people are predicting worse. So we'll see if we're in the 300 range, we have a high day and we come back down, or is our range closer to 400 after Thanksgiving? We're going to find out. So that's a lot of work on our infrastructure related to investigating and then quickly turning your investigation over to the contact tracing so you can get quarantine set. So it's a challenge. Tomorrow is going to be the worst day. Hopefully it's a one-day occurrence and we get some relief back down to the 300 range where we were, but we're going to find out. Looking at who's been impacted, 7,188 females, 6,161 males, 19 and under, 2,065. In their 20s, 2,939. In your 30s, 1,908. 40s, 1,591. Your 50s, 1,901. Your 60s, 1,371. Your 70s, 795. 80s, 535. And 90s, 298. On cases, the contact tracing, so I understand the anxiety in the community when we have cases increasing. We don't minimize this whatsoever because we're the ones who have to work and investigate these cases. The pressure that leaders in these roles face are talking about more cases means lockdown. That's the answer to these things. If the data showed us a clear path that making a regulation on the economy for a period of time would work and drive these cases and cut them in half or even better, we would be doing that. What the data shows us is that it may not even be 70% of the cases now. It might even be 80 of the cases we have are related to spread in homes or gatherings that the government can't regulate. These are choices that are being made by people in their property. Then you have household contacts that come after that decision, and then we have senior facilities, unfortunately, that have been invaded by this virus again. And so then after that, you have 10-15% of the cases are somewhere else. There's not a clear indicator. Like at other points in this pandemic, we've been able to say, you know what, we had 30 cases today. half of them came from hospitality. That's a challenge, this or that. That's not where we are now. So earlier we could put a regulation on, we could look at this, try to figure out how to slow down the spread that way. That's not where we are. So I understand the anxiety. If there was an easy fix, we would be doing it. There's not an easy fix at this point. These are peak conditions for any virus in the COVID family to spread, and this is where we are, and we need to do the things that we can control as a community, and that is making good decisions related to your social gatherings. That's if you're sick, you have to get tested. That's looking at your own commercial activity and slowing it down or consolidating it. Instead of going out 3 or 4 days during a week to go run errands, maybe you do it 1 day a week. These are all things that seem very small, but these small things will add up and help us have good outcomes and flatten this caseload. Testing. Why is testing our big strategy? A, it's something we can control. And B, to get the cases flattened and going down, it's called an R factor, the reinfection rate. At one point in this pandemic, in the summer and in the early fall, we had a reinfection rate that was one of the best in the country, and it was under 1%. So that means for every new case, they were infecting less than one new person. That's how you get it down. So the only way we can get our R factor at 1, which means for every new case we have 1 new infection, or better, is we have to identify the virus. We have to find it. So in a hypothetical way, if I came out here one day and told you we found 10,000 new cases, but we did 50,000 new tests, and we could isolate all these people in quarantine and box it in, that would be a good day because we found it. So we need to find this virus. How do we find it? We test. We offer asymptomatic testing. We're doing that. We increase our symptomatic testing so people can get it done quicker. We're doing that. We try to procure more rapid technology. We're trying to do that. But we need people when they're sick to get a test. And then when you're sick with a test, you have to assume you have COVID. So then you put yourself in your own quarantine until you know you don't have COVID. So looking at symptomatic testing this week, we've increased capacity at the FSHED, ongov.net/Cayuga Medical, Monday through Friday. Weekend symptomatic testing, this is new, that we're working with our partners. On weekends, we've seen, when you look at the data that comes out, high positivity rates on the days from weekend tests because you have people who are sick getting tested, not a lot of other testing. And then during the week, you have broad-based testing, and so your positivity rates stabilize and give you a more true reflection. Looking at this, Saturday, we will have a new partnership with Cayuga Medical and Essentia Health from 8 a.m. to noon, both Saturday and Sunday, at Essentia Health's offices at 1050 West Genesee Street in the city of Syracuse. Will be more weekend testing. Please go to ongov.net/Cayuga Medical for an appointment. So we're increasing the testing capacity on weekends, and we'll continue to look at that and work to meet those demands. Asymptomatic testing at the On Center, we've had lots of activity. Again, if you're asymptomatic and you want to test, free test at the On Center, covid19.ongov.net. Please pre-register. There are slots. This is key. Every positive we find here is one that we didn't know about that will help us with our reinfection rate. Asymptomatic community testing today, 1,715 tests were done, 14 positives, 0.82% positivity rate. In schools, we did 1,015 with 3 positives, 0.296%. Good positive rate, still showing us that there is not transmission happening in these schools, so that is positive. We now have a board set up, I believe, to my right, where we have new locations next week for community testing. There's more than 325 available appointments at each location. Again, please register at ongov.net. Tuesday, December 15th, Solvay Fire Department, East Syracuse Village Hall, and the Clay Senior Center. Wednesday on the 16th, back to the Fayetteville Senior Center, back to Shove Park and Fayetteville Village Hall. So actually the Fayetteville Senior Center, I think, is our first one there. I think we're at the Village Hall there. So again, that's on Wednesday. On Thursday, December 17th, we are at Shove Park again in Baldwinsville at the Canton Woods Senior Center. And then Friday, we are at Salina Town Hall and Onondaga Town Hall. Again, we need to identify where the virus is to start to flatten these curves. This is how we're going to do it. Please, please, please pre-register, get tested. You can get tested more than once at all these. We've had some testing heroes on social media. My friend Syracuse Waterboy, if he's watching, he comes down every few days and gets a test. So nobody promotes our testing program more than the Waterboy. Looking at testing set on Monday as well, we are going to, in partnership with the Cicero American Legion, do veterans testing for our vets. So that is good as well. New York alerts, to receive text messages about testing sites, please go to alert.newyork.gov and sign up. Select Onondaga County, and then when we push out communications, you'll get those texted to you. Those are helpful. And so certainly want to just reiterate basics. Please think about these rules, whether you agree with these rules or not. Think about our medical teams and our hospitals, the work they're doing, the teams our health department's doing, our county workforce, which is now really working overtime on case investigations. Please physically distance, please wear your mask, sanitize, do the things we've talked about, stay at home when you're sick, get a test, modify your commercial activity, certainly your social activity now, hopefully you've already modified, but these are all things we need your help with. Our seniors, any reminder to our seniors, if you have a challenge, you need help, please contact 315-218-1987. Property taxes, and many residents of towns, property tax bills are coming. Our town supervisors reached out to me and asked that they have limited resources as far as a workforce. Obviously, the more people that come together, the more interaction, the more risk there. They've asked that people really take advantage of paying your taxes online, mailing in your check, and they even have drop boxes at the town halls if you want to drop them off, to please look at that and take advantage of that way to limit some of the interaction. So please consider using those tools for property taxes. Certainly tonight there is the Medical Society has their annual banquet virtually online. Dr. Gupta is receiving an award for her work. Dr. Stephen Thomas will be moderating it, two of our frontline heroes. I'll be also receiving an award on behalf of our county team, and I'm proud of our county team, and I'll be accepting that on behalf of our county team that has worked so well in this pandemic. And certainly somebody who is going to be recognized posthumously is Dr. Adeline Fagan. You've all covered her story. It's a touching one, and certainly a very proper recognition tonight. So certainly congratulations to all of our heroes there for all the work that they've done and will continue to do moving forward in the pandemic. Happy to take questions.
I have a few questions about the transitional homes. You mentioned it briefly today, but then also 2 days ago you tweeted that you're working on the COVID building for nursing home residents awaiting the negative COVID test. What can you tell us, if anything, more about this building or buildings? Yeah,
we'll work with an existing nursing home operator on a building they have, and we'll essentially, it will turn into a there's COVID units in various facilities, which is one floor, but this will turn into a COVID, essentially, building. And we don't anticipate this problem going away for the next 90 days. The positive news, vaccine distribution to these populations is going to be happening. And so that hopefully will stop the bleeding here for our most vulnerable. but this is going to be a challenge in the near future, just based off of who was already sick with the virus. So again, we need the state DOH to work with us on this. I don't want to get too far down the details in case they say no to the plan, and then that creates other issues. So, but we are comfortable it's a sound plan and one that will meet the challenge that we have right now.
I know that you mentioned this plan that you're submitting to the state. I went back through some of the old press conferences, and you mentioned submitting a plan for the same concept back in June and also in May. So that was like over 6 months ago.
Yeah.
So can you kind of explain what's different this time? You know, what's kind of been happening from then?
Yeah, we never got word back on those plans. One of the plans was in Oswego County for a facility. I think it's still being considered. This round would be a facility in Onondaga County. And so it's not the same. This was an issue, a very big issue in May. Remember, in May, you put things in perspective, right? I think we had 60 hospitalizations, probably 20, 25 residents that shouldn't have been in the hospital. This number was being held against us for restart. So the pressure was to get your economy open. The people that didn't need to be in the hospital, you wanted not there. Now these are folks, again, we need them out of the hospital because we need those beds for other sick people. So it just shows you how the same issue has come up, but for very different reasons, why we need the same outcome now.
So those in the transition home or these like COVID units, would they count towards the hospital?
No.
They would, okay.
Yeah,
it
so
would
these
help
are
the
individuals,
economy.
they no longer need hospital care. So the only thing stopping them from going back to their homes are this executive order that you need to test negative. Again, you can recover from COVID and be perfectly healthy and not test negative for months. So each person's different.
And it's gonna be part of these nursing homes or these?
It would be
nursing home units?
its own entity. It would be a nursing home, but it would be strictly for COVID recoveries and potentially COVID patients too.
Gotcha. Thank you.
How big?
Right now we're looking at about 100 beds.
You gave us a lot of numbers. Are you saying that some of the hospitals are full with their normal business patients and could easily move those people out in future days to continue increasing COVID capacity?
Yeah, so the numbers, what I think is important with hospitalizations, because you hear we're now focused in on the numbers so much and the COVID numbers. You can't, hospitals are always busy. And so it's a matter of now we're tracking the beds each day. And what's even harder to track is the staff and the fatigue. But where we are from a hospital standpoint is we're actually, this is even before the governor's 25% increase. You can increase the rooms in capacity quite easy. It's just the staffing. And so where we are right now is we've been trickling up over the last probably say 2 weeks. We kind of spiked up. The last 2 weeks we've been trickling up. We've had a couple good days where we were flat, a couple days where we actually went down a little bit but then bounced back up. But we've been in this kind of 70% capacity range of existing beds. So we're in a pretty good spot from meeting the regulations and meeting the beds and the ability to treat our sick from a bed capacity. Certainly if you get in an extended increased case level from 300 and you go from 300 to 600 a day, you're then going to challenge all of that. You're challenging everything. You'll challenge our ability to do contact tracing and investigations. So just because right now we can, even with these elevated cases, we can treat our sick, we're having a hard time doing it. It's a lot of work. People are tired. And so that's why we need the community to help us. And again, the growth, everyone always said we're going to see increased case levels. I think how fast it happened is what surprised people. It wasn't a gradual case growth. It was 30 cases, then boom, 200. And maybe you get down a little bit. So now the Thanksgiving surge has brought us to the 300 level. Some thought it would bring us worse. Again, we're going to have a high case day tomorrow. We'll see if that's the new norm or if it's an outlier. We've had low day outliers. Today's low 293 might be a low day outlier from where we really are.
When you say 70% capacity, does that mean coronavirus patients of 70% corona, 30% others? or it's 70%?
70% hospital-wide. COVID-19, I mean, we only have you got 1,700 beds almost, and you got 248 COVID, right? So that capacity's not there. And again, there's no difference in how they treat where the patient really sits. If you're in an ICU bed, it's the same type of technology and equipment for COVID or anything else. So we don't differentiate anymore. We look at the overall ability to treat our sick, because we need these hospitals for a lot more than COVID.
You mentioned the numbers of new cases somewhat stabilizing high. We expect this spike tomorrow. What's leading to tomorrow? Is it the right amount of time after Thanksgiving?
Could be. And sometimes with the way the labs report, our labs that we work with are pretty standard. I've gotten word that the national labs, again, are backed up a little bit. So if you get, again, your standard 48-hour turns, and then you get a slog of ones from 5 days ago and 7 days ago hitting you, that could be it, Andrew. Or it could be that's where we are, and we'll see it play through. It'll be interesting. We're doing more wastewater testing samples that we saw with our wastewater what happened on October. You could see the intensity pick up. So we're interested to see what this next testing level shows. We sent it to the lab today, and to see if it is the same kind of intensity or is it more, to give us an idea maybe about predictive analytics moving forward. But tomorrow will be the high, and hopefully it's an outlier and we'll come back down, but we're under a lot of pressure.
Do you think 400?
I think we'll see 400 tomorrow. I think so. We got it. So the state, and we get a lot of questions on this online. I spend a lot of time tweeting at people about this. The state each morning sends us, or after in the afternoon. So this morning, the state reported a number. We get sent over these cases. It doesn't matter if the state's 100% accurate per county, because they're all New York State. So their macro number is accurate. Per county number is not accurate, because if you got tested in Onondaga County, you could be in our county, but you could live in Cayuga. So that eventually becomes Cayuga's case. So we got a slew this morning, and now we do our investigations, and part of that is making sure they're in the right county, and you transfer them out, and then that's your number. And then that will take us today to work through these, so I know what the number is, and I'll report that accurate number tomorrow.
Ryan, back to hospitals. As you talk to the hospital leaders, is it realistic that they can add 25% to their capacity with staffing? With staffing? I mean,
I don't know if that.
Without staffing is pretty useless, right?
Yeah, I think it's a fair point. And so I think you can add up the capacity, and then I think if you get to where you need that capacity, so you got the beds, and then you need help to have people staff it, then I think you look at, you go to your voluntary list. I think the governor probably has some other options that he can exercise for emergency hospitals with the National Guard and things like that. So I think I think there are some tools in the toolbox at the state level if you get a community that is overrun. So initial order, build up capacity in the event we need it, and then if we need it, then I think the state has some tools that they can respond to. We don't have those tools at the local level. Certainly the state and the federal government do.
What kind of response have you gotten from those voluntary lists? I don't know if they come to you or the state that the governor is looking to get retired EMTs.
Yeah, I'm not sure, Trish. I think, we have our own list of volunteers that we have locally that we can tap into. I'm not sure what the state has seen from some of their regulatory changes allowing doctors and nurses not to have to get re-registered again to be able to help. Hopefully they're seeing a response, and I'm sure they will. New Yorkers are going to take care of each other.
The FDA is discussing right now possibly approving the Pfizer vaccine as soon as tonight. I'm wondering when you expect the first vaccines in Onondaga County. Is it next week?
I believe so. I think we'll have, you'll have distribution sites at some hospitals, and then you'll have 4 other hospitals to use their frontline workers, and then you'll see a partnership with the federal government managing a relationship with pharmacies working with nursing homes. And so I think next week, Onondaga County residents will be getting the first vaccine, which is proven to be 50% effective right away, which is nice. And then 3 weeks later, those same residents will get the second dose of Pfizer. And within that 3 weeks, we might even see the Moderna vaccine distributed in the first wave too. So that's the positive news with all this. That's what's so different with all this. The second wave, better grounds for the COVID virus to flourish in, like other colds and flus. These seasons are stronger for them. It's harder. When we look at the data, we know more about the virus, so you can't just make rash decisions now. You have to look at the data and say, why would we make this decision? And as leaders, we struggle. We want to be able to stop the pain that we have to talk about. There's just not easy answers to this. And then we've talked about this being a grind. That's what it is. The light is that we have our most vulnerable and our frontline heroes are going to be receiving a very effective vaccine in a week.
It sounds like you described two paths there, that the federal government is working with some pharmacies to get them into nursing homes, get the vaccine into nursing homes, but then some hospitals will be given an allotment to vaccinate its frontline staff?
Correct. Yeah, and the hospitals that have the infrastructure, that the Pfizer vaccine needs to be held at a certain temperature, so there's certain freezers that vaccine needs. So those hospitals that have that infrastructure will kind of be distribution networks for not just their hospital. Again, I'm not sure if our three big ones all have that infrastructure or not, but regardless, the certain type of healthcare professional will be getting vaccinated. And I believe what I've learned with the federal program with the nursing homes is a third of the nursing home employees will be vaccinated at a time, because you can't vaccinate all the employees at once in the event that there's side effects and people then all of a sudden are sick. So that's what we've learned, and hopefully next week we'll have our most vulnerable getting this vaccine, and then we'll continue as we get through phase 1 here. There's a phase 2, and then you get into phase 3 where it gets a little bit more harder with distribution into the public. Your public members of the community that are vulnerable, your independent seniors, people who have underlying conditions. So this will be a little bit harder. That's where your local governments really step in and help with vaccine distribution.
I was going to ask, the county government next week isn't entirely part of the distribution. I mean, you have enough to do, so I'm sure you're happy to have something off your plate for a week. That's more federal government direct to pharmacy into nursing homes.
Correct.
And the state government probably getting it to big hospitals.
Correct.
Okay.
Yep.
And the governor's mentioned regional distribution sites. Do you know what those are in Onondaga County?
We haven't gone through all of them yet. I think some of those will happen as our plans become more relevant with the vaccine becoming available. We have some ideas. We've talked about some ideas with Shoppingtown Mall being one of them. Certainly this building could be another one. We have the War Memorial. We have large facilities that we could do things. But I think the initial distributions will be these hospitals that have the infrastructure to take it, to get the first responders and the healthcare professionals done.
How quickly might you need places like Shoppingtown Mall or the On Center for people to line up and get a vaccine?
Yeah, I think we're going to be okay for the next month. I don't see the capacity being there where we shift to those types of operations. But look at, if we were told tomorrow that you're going to have another 25,000 doses of a vaccine, that would be very good news. We'll make things work.
I have just two follow-ups with the transitional homes. Is there any reason to expect a different outcome from the DOH this time around, if they never even responded to you way back then?
There has to be. This is different for a different reason, right? So when we had the problem before, it hurts our restart numbers. You essentially had these hospitals becoming dorms for a period of time, but there was never a capacity issue in the hospitals. So the pressure on DOH to make these decisions, it went away. This time, we are expecting more hospitalizations, so we need to get folks that don't need to be there out of there. So I expect a quick turn time from DOH.
And then last question is, any idea of who would staff this? And then also, if someone can test positive, even when they're recovered, up to a month or so after that, would they be allowed to stay in this, I guess, unit for that long?
Yeah, so essentially this would be a COVID facility, so you'd use it for other COVID patients as well from other venues. It would be staffed by certainly some nursing home personnel and potentially some hospital personnel, because we're saving hospital capacity as well. So these staff would be just for this building, though. We wouldn't have them jumping from a COVID building to other buildings where there's not the virus.
That's important because the state is carefully watching hospital capacity to decide whether we go into a red zone.
Yep.
And we're at 76% now, at least as of yesterday. And it's still not clear to me that we're going to add 25% to our capacity. So today was probably a good number because we only added one.
Tim, I think the number for 90, I think I know the question. My understanding is the 90% number is not based off of the 1,700 beds. It's based off of the 25%. So you would say it's 1,600. It's not. It's 1,700. But for simple math, for a guy like me, 400 new beds on top of 1,600 is 2,000. My understanding is to go to a red zone, you would need 1,800 residents under that circumstance. And again, today we have 1,200. So you have a 33% capacity there. That's my understanding.
Will they look at that county by county, or is that a regional?
It will be regional. So to your very good point. So if one of the other hospitals is performing better, that helps your numbers. If it's performing worse, it hurts your numbers.
But you're pretty confident on that metric that we are not near entering a red zone?
Correct. Look, this is very simple. The hospitals are based off of active cases, right? So 8%, I think, was the number, close to it, with our active cases. Actually 9% of our active cases are in the hospital. So we have 2,500 today. If you double that, all bets are off, right? So this has been a tried and true number throughout the pandemic. So that's why you can't just say, okay, with vaccines here, we're not going to distance, we're not going to modify our social behavior, we're not going to do anything, because these numbers will skyrocket in weeks, and then all of a sudden you're going to be in a red zone, right? But the red zone, the zones won't solve this problem, though, if we get there. Let's be honest. The problem right now is being driven outside of any zones. If we get to the point where the hospitals are overrun, these regulations would take a long time to have any impact if the community doesn't want to change their behavior, because no zone, doesn't matter what zone you're in, changes if you're going to have 12 people over to watch a football game. No government can regulate that. I know some people want me to. We don't have the ability to. And I'm being honest with people. So the zones won't change if we get to the point where our hospitals are overblown. The community has to make the effort and the decision. And the conditions of this virus are on the virus's side right now. So it makes it that much harder. So slow growth is good growth until we can get the conditions turned going the other way here.
Is that why we haven't seen the zone change in 2 weeks? And if they're not really controlling people from gathering at home and that's where the virus is spread, why are salons and gyms still forced to?
The data to us is very clear. We've asked the state to allow salons and gyms to be open. The data is very clear on this. I think it's tough to say, if you're the state, you have increased cases, do we loosen up that valve? The valve, there's no water flowing through the valve at anyways. So loosen and tightening doesn't matter. Nothing's coming through because those aren't where the cases are coming from. So, I think the impact on a salon owner, which can't get a PPP loan because they're qualified as self-employed, how do they take care of their family? That's another set of public health issues. So I think that's the challenge with the data is when you see increased cases, your gut reaction is you got to turn off the valve. Right now, the valve is flowing in people's homes. How do you do that? If somebody can figure it out, we're all ears. It's not happening in commercial businesses the way when you had 30 cases or 40 cases, that's when it was driving those in the summer and in the fall. We had nine months, or essentially 6 months with this virus where the conditions were more beneficial to us in our fight with the virus. Now is wintertime. The conditions being indoors have turned. The tables have turned. The virus has the conditions where it wants it, so we have to do more to level the playing field.
You have restaurant owners literally hoping they wake up one morning and the zones are changed so they can let people in. I mean, Shifty's has shut down entirely for now. My Darling announced last night that they're doing the same. That's tax dollars that aren't coming in because these places aren't even giving it a go because they're not able to. Does the state know from you how imminent that problem is, and what is their response?
Yeah, I think hospitality is tough, Andrew, because it's based off gathering where masks aren't being worn. People are having drinks. We've all had drinks, and our judgment's been impaired. So that's a tougher argument than salons and gyms. These restaurants and businesses need PPP from the federal government in a bad way to keep their employees going. That will allow them to keep going and do takeout and do limited indoor dining where they can. But they need that in a bad way. We've seen hospitality drive caseloads. It's not driving the cases now because in many cases they haven't been allowed to be open to begin with, to your point. But we need to get these folks help in a big way. And the federal government's very close. They're very, very close right now. They need to do the right thing.
And I realize we live in a society, whether you're, a McMahon child in school and some kid in the classroom's doing something bad, sometimes the whole class gets punished. Is that true with hospitality, that you have some really good business owners who really locked down their operation to meet the expectations, but you had some not, right?
Yeah.
The counties issued fines, you sent out inspectors, you found some bad apples. Are some good business owners suffering because some bad business owners didn't do the right thing?
Yeah, I would certainly say in the beginning when the zones happened, right? I think if you look at the 13202 zip code, got bundled in the orange zone because it was surrounded by orange. That hurt a lot of business owners. And you certainly had some businesses that didn't take this situation very seriously and live up to the rules that they said they were going to regulate. Now it's different, though, Andrew. If you're starting from a clean slate, even if you're doing everything right, having that many people when under these conditions for this virus, there's more risk, right? And that's not these business owners' fault. This is the type of business, and this is the 100-year pandemic that gets to pick on certain industries. So that's why we need to get them help, and that's why the federal government needs to do its job, so that there's Main Street and downtowns. There's something to come back to when we've gotten the vaccine distributed through the majority of the population. So I think I would agree with the sentiment. Did some ruin it for their peers in the beginning? Yeah, but now 6-7 weeks later, I don't know if that's the case anymore. I just think the conditions are so much in favor of this virus being in a room that you got to be careful.
Should they not be as eager to reopen indoor dining within weeks and maybe look to January?
I can't tell somebody not to be eager to try to make a living and do and perform your
What's
craft.
but
yeah, I don't think the idea of anything more than a 25% capacity indoors is realistic at this point.
Orange isn't even 25%.
Correct. I don't think we've if you're the state's going to have to make the decision where they're going with that. If they're going everybody to yellow or orange, we've again, there's certain zip codes that got bundled into orange that we disagree with, and if it's going to be by positivity rates, the ones that fell within the orange areas around them, we don't think should be in it. But I don't know where their state's going. I think they're going more to a hospital-based system, and maybe they'll come out with new guidance soon.
When do you think those zones will change? Because the positivity rate has gone up, the hospitalizations have gone up. We haven't seen any changes really across the state in a while.
Yeah, I don't think the positivity rate matters with changes anymore. I think they're going all hospitalization, and I think you'll see, potentially you'll see the yellow zones. The governor talked about a week of increased hospitalizations. I don't know what he means by what kind of level of increases. Certainly if you're going up one a day for a week, I don't see that being substantial, but I think it wouldn't surprise me to see that yellow zone restriction across the state if we're having an honest conversation. That would not surprise me. I would be very surprised with communities hitting red zones anytime soon based off of where we are right now and how fast the medical community is now at treating our sick and how people are getting better quicker in this bout with this virus.
As for the vaccine distribution in nursing homes, do you know how the consent goes? Does it family members have to approve? Do the nursing home residents have a choice at all?
I believe some residents that have the cognitive ability do have, it is their call. And I think their power of attorney makes the call for them if they do not. Each home was supposed to team up with a pharmacy that are national partners with the federal government. And then you, essentially my understanding is you'll have pharmacists and or employees of Walgreens and CVS going into the nursing home and giving the vaccine. I think that's how it's been explained to us from our federal partners.
Aware of any law enforcement locally being involved in protecting the distribution?
I've not heard that, Andrew. Yeah.
Ryan, you mentioned the R factor, the rate of transmission. I know it's a super complicated calculation. Have you heard from any of the researchers what that factor is?
Tim, I think we were at 1.2 maybe a week ago, 10 days ago. I'm not quite sure where we are now. Certainly, to get it under 1 or at 1, you need to find the virus, and that's our strategy, is to find it. And that's some strategies where don't find it and don't test. Ours is the opposite. We want to test and we want to find it so we can isolate it, and we think that's how we'll get the R factor. And eventually, that's how we're going to flatten this out. You got a lot of circumstances working against you now, right? You have the best season for a virus like this. This is when the best conditions. You have the Halloween, Thanksgiving, Hanukkah, and Christmas and Kwanzaa events all happening during these circumstances. And so it's trying to somehow keep this thing as flat as we can during all this so that we get through it and we can really get it flattened and start to get it curved. That's what we really got to do.
And just a detail, you mentioned the weekend testing
Yeah.
at Nescence's office. I see the hours up on the board starting December 19th. Does that start this weekend or next weekend?
This weekend. This weekend.
It starts the 12th?
The 12th. I don't know who put the 19th up there, Tim. They're in big trouble, though.
Head.
Yeah. It's going to be available on the 19th as well. But you can go to the 12th. Yeah.
Do you think that the positivity rate is depressed at all by doing so many school tests where you're getting only a handful of negatives?
No, because what we're doing now is we're getting an accurate reflection of the community. You can't just test sick people. Why even how are you going to make a decision off of somebody who's got COVID testing for COVID and telling you they have COVID? So to have a real reflection of how it's impacting the community and the risks to the community, you need to test multiple different areas geographically, try to get into different ethnic and racial backgrounds in the community so that you can see where this virus is everywhere. If we are going to be testing and saying it's safe for kids to be in school, which we're proving it to be the case, and I'm a huge advocate of that, you need to test in the schools to make sure it's safe for the kids to be in school. So it gives you more of an idea. If you remember back when we were first dealing with this, remember the antibody test that the state was going around and doing around the state? They were doing what we're trying to prove right now. They were trying to figure out through the state's antibody test, what's the real infection rate, not just what the real testing rate is with symptomatic testing. So that gives you an accurate positivity rate. If we just did the F-shed testing and that was it, just testing sick people, these positive rates would be very different. And how do you make a good decision on policy based off of skewed information?
Do you think those tests are worth it if they're only 60% accurate on kids?
What tests?
The rapid tests.
I think, I don't know if I agree with that. I will have to talk to our team if they agree with it, that they're 60% accurate or not. But I do think that the testing is worth it, and we're a believer in testing. Anything else?